What if you had to save your own life? Imagine you're alone, and suddenly it hits you that intense chest pain, a crushing pressure like an elephant is sitting on your chest. The pain starts creeping into your arm and jaw. You're nowhere near a hospital, and you know every second is critical. What do? In a moment like that, where help is minutes away, the choices you make in the first few seconds can be the difference between life and death. The window you have to think clearly and act might be short. So, what's the plan? I'm Dr. Esteban. I've been a cardiologist for 40 years, and I've seen this exact moment of terror play out with thousands of patients. I've seen the tragic results of panic, but I've also seen the incredible stories of people who survived because they knew what to do. My goal here is simple: to replace that panic with a clear, medically proven plan. The steps I'm about to share are direct and designed to save your life. We're going to walk through what you need to do in the first crucial seconds and the minutes that follow. Many of my patients, like a man we'll call Mr. Jose, used these exact steps and lived to tell the tale. Stick with me, because this could be the most important information you ever learn. Before we get to the plan, you need to understand what's going on inside your body. A heart attack happens when blood flow to your heart muscle gets blocked. Think of your heart's arteries as pipes supplying it with oxygen-rich blood. During a heart attack, one of those pipes gets clogged, usually by a blood clot. Without blood, that part of the heart muscle starts to die. The longer it's blocked, the more damage is done. Time isn't just money. In this case, time is muscle. Now, let's get one thing straight. A real-life heart attack often looks nothing like what you see in the movies. It's not always a dramatic chest clutch and collapse. A lot of heart attacks start slowly, with mild pain or discomfort. So many people wait to get help because they're expecting a Hollywood heart attack. The warning signs can be tricky. The classic one is chest discomfort, that pressure, squeezing, or fullness in the center of your chest that lasts for more than a few minutes, or goes away and comes back. That pain can also show up in your shoulders, one or both arms, your back, neck, jaw, or even your stomach. Other big signs are shortness of breath, breaking out in a cold sweat, feeling nauseous, or getting lightheaded. And this is really important. Women can experience different symptoms. They're more likely than men to have shortness of breath, nausea, and back or jaw pain. I can't tell you how many of my female patients first dismiss their symptoms as just bad indigestion or feeling tired. You have to trust your gut. If something feels deeply wrong, you need to act. So many survivors, including Mr. Jose, told me later, "I just knew something was terribly wrong." Okay, let's get to the reason you're here. Your immediate 10-second survival plan.
When the symptoms hit and you're alone, the clock is ticking. Panic is your worst enemy. A clear plan is your best friend. Here are the 2 things you absolutely must do first. Step 1. Make the call immediately. Before you do anything else, before you call a family member, before you look for a glass of water, you have to call 911 or your local emergency number. This is step 1. It's the most important, and it is absolutely non-negotiable. So many people hesitate. They worry it's a false alarm, or that they'll be a bother. Let me be blunt. It's a potentially fatal mistake. Paramedics start life-saving treatment the second they get to you, often giving you treatments in the ambulance that can stop the damage to your heart. Every single minute you delay that call, more of your heart muscle dies. This is exactly what Mr. Jose did. The moment he felt that crushing pressure, he didn't second-guess it. He grabbed his phone and dialed 911. That single decision is why he's alive today. When you call, be direct. Say, "I think I am having a heart attack," and give them your location. Stay on the phone with the dispatcher. They'll tell you what to do until help arrives. Step 2. Take an aspirin. After you've called for help, and only if it doesn't delay the call, your next move is to find an aspirin. If you aren't allergic and your doctor hasn't told you to avoid it, chew 1 regular strength, 325 mg aspirin. If you only have low dose or baby aspirin, 81 mg, chew 2 of them. Why chew it? Chewing gets the aspirin into your bloodstream way faster than just swallowing it. Aspirin is a powerhouse during a heart attack because it thins the blood. It helps stop the clot in your artery from getting bigger, which can buy you precious time and reduce the total damage to your heart. It's a tiny action that has a huge impact. Mr. Jose remembered this. After his 911 call, he walked to his medicine cabinet and chewed an aspirin. He told me it felt like the longest 30 seconds of his life, but he knew he was fighting back. Just remember, don't take aspirin if you know you're allergic, or a doctor has specifically told you not to. You've made the call. You've taken the aspirin. Help is on the way. Now, what you do next is all about putting less strain on your heart and getting ready for the paramedics. Step 3. Get into position, rest, and breathe. Stop everything you're doing. Any kind of movement puts more stress on your struggling heart. Sit down and get into a comfortable position. The key is to rest and take the strain off your heart. Lying down is also a good idea, especially if you feel dizzy or like you might faint, because it will protect you from getting hurt if you fall. While you're resting, focus on your breathing. You're going to feel anxious, and that makes you want to take fast, shallow breaths. Fight that urge. Take slow, deep breaths. In through your nose, and slowly out through your mouth. This keeps you oxygenated and can actually help calm you down, keeping the panic from taking over. Mr. Jose found a spot on his living room floor, sat down, and just focused on counting his breaths. It kept him grounded until he heard the sirens. Step 4. Get ready for your rescuers. This last step is simple, practical, and it can save a ton of time. After you've sat down, and only if you can do it without straining yourself, go unlock your front door. This lets the paramedics get in without having to break it down. Once it's unlocked, go right back to your resting spot, preferably somewhere they can see you easily as soon as they walk in. Keep your phone next to you in case the dispatcher calls back. If you have a list of your medications and allergies, try to have it nearby. Mr. Jose unlocked his door and then lay down in the hallway where he knew he'd be seen immediately. These little things can shave minutes off the response time, and in a heart attack, every second counts. On the internet, bad information spreads fast, and when it comes to a heart attack, it can be just as dangerous as the attack itself. There are 2 myths I need to bust right now, because believing them could cost you your life. First, this dangerous idea of cough CPR. You might have seen viral emails or posts claiming you can stop a heart attack by coughing hard and repeatedly. This is a harmful myth. It is not supported by the American Heart Association or any other credible medical group. A heart attack is a blockage problem, not always a rhythm problem. Coughing will not clear a blocked artery. Wasting your precious time on this instead of calling 911 is a terrible, potentially fatal mistake. Second, and listen to me on this, do not drive yourself to the hospital. I don't care if you think it's only 5 minutes away. It is a massive risk. During a heart attack, you could lose consciousness or go into cardiac arrest at any second. If that happens while you're driving, you not only won't get help, but you'll become a danger to every single person on the road. Waiting for an ambulance is always the right and safest choice. Surviving the heart attack itself is goal number 1, but the work isn't over. The real win is making sure it never happens again. If you have risk factors like high blood pressure, high cholesterol, diabetes, a family history of heart disease, or if you smoke, you need to have a serious talk with your doctor. Make a heart attack survival plan right now. Put a list of your medications and allergies in your wallet. Keep a bottle of aspirin where you can easily get to it, both at home and maybe in your car. If you live alone and are at high risk, think about getting a medical alert device that can call for help even if you can't. Understanding your own body and fighting for your own health is the best thing you can do for yourself. Mr. Jose's survival wasn't just luck. It was knowledge and preparation. After he recovered, he worked with his doctors to get his blood pressure and cholesterol under control, and now he's a huge advocate for heart health in his community. Let's run through the life-saving steps one more time. First, call 911 immediately, no hesitation. Second, chew an aspirin or 2 baby aspirins if you can. Third, stop moving, sit or lie down, and breathe slowly and deeply. Number 4, if you're able, unlock your door for the paramedics. These 4 steps are your shield. The fear of something like this happening when you're alone is real. But this plan gives you a way to fight through that fear. If you found this helpful, please like this video and subscribe for more real-world health advice. And now, I want you to do something important. Think of one person you care about. Share this video with them. You're not just sending a link, you're giving them a plan that could one day save their life. You could be the reason a friend, a parent, or someone you love survives. Please, be that person. Knowledge is power. Today, you've armed yourself with the power to face one of the scariest moments a person can go through. You're more prepared now than you were a few minutes ago. You have a plan. We all hope you never, ever have to use this information, but knowing these steps can turn panic into purpose and helplessness into action. Take care of your heart and be ready. Thanks for watching.